This is a Behind the Pets veterinary educational video sponsored by Toa Payoh Vets. Hello! Today we shall be looking into the case of a ear abscess in a terrapin. So what is a ear abscess? How do you treat one? Well, let's find out. A few years ago, a concerned owner brought his pet terrapin to Toa Payoh Vets for a checkup. He had noticed that his pet terrapin had developed a large swelling on his right cheek. Out of concern that it may lead to worse or more serious complications, the owner decided that his terrapin had to have a checkup. So, in all actuality, the swelling was actually an abscess. But firstly, what is an abscess? Well, let's look at the definition. To put it simply, an abscess is basically just like a giant pimple, except one that is far more serious and deadly in its consequences. An abscess forms due to a close infection beneath the skin. This causes the accumulation of pus within tissues, and as such causes swelling and redness at the site. Common symptoms include a loss of appetite, discomfort, visible swelling, redness, sensitivity, and pain, as well as other symptoms. So, are abscesses just like giant pimples that essentially cause no harm to your pet? Wrong! Abscesses can be deadly. For example, in the case of this terrapin with an abscess in its ear canal, the toxic pus within the abscess might have actually traveled to its brain and eventually killed it. As such, it required emergency medical help immediately and had to be brought to a vet for surgery. In order to perform a proper diagnosis on the terrapin, we first had to perform a physical examination on it. Here, the terrapin is being weighed by being placed on a weighing scale. The purpose of the weighing is to check if it has a normal weight. Secondly, the terrapin was physically examined. In the first part, the terrapin was checked for any external signs of diseases that may have been missed in the initial diagnosis. In the second part, the terrapin was checked for its gender. In this case, the terrapin was female. So, what's the treatment like for a ear abscess in a terrapin? Before surgery, the terrapin was anesthetized using isoflurane and oxygen gas. This is needed as surgery is very painful, and we need to anesthetize the animal to prevent it from struggling during the surgery itself. In this case, also we use a container method over a gas mask method, as it is very hard to observe breathing and also the eye blinking reflex in terrapins, as such increasing the risk of an overdose from the anesthesia. So, let us now watch a video of how the terrapin was anesthetized.
Right, not so good.
You can hold your breath, so they very hold.
Go direct mask or what?
You can still hold your breath. You will try.
I will try.
Then do it how you want to do it. Who's stopping you?
Secondly, we shall lens or pierce the abscess. Using a scalpel, a 5mm wide incision was made along the abscess. This was made on the lower part of the abscess in order to allow for better drainage of the pus contained within. Let us now watch real-life footage of the lensing process.
Okay, press some more. One hand press, one hand hold. One hand you hold. Because I'm doing video, so I cannot do. Little bit. Okay, hold.
Okay,
Okay, go. Wait. I need the light. No light here. Wait.
Following lensing, water was squirted into the wound to clean it and to remove as much remaining pus as possible. This process is called syringing, as we are using a 20cc syringe during the procedure.
There's a hole. Shoot some more. That's why you need a 20cc. Because if you only got 5cc or 2cc, it take a long time. The hole there, the hole. Where's the hole? Show the hole is there. Clean already.
Yeah, clean already.
Show the light. Turn to the light.
Cool.
Okay, very clean. Okay. So we close already. Okay, bring.
Post-operation. After the surgery, the terrapin was allowed to rest. 12 hours after the surgery, the swelling was observed to have been reduced by 50% and the terrapin was stable. As a follow-up, the owner reported that 7 days after the surgery, the terrapin had started to eat. This is a good sign and showed that the terrapin was in fine shape. So, what conclusions may we take away from this case? Well, firstly and most importantly, early treatment saves lives. In the case of abscesses, it is important that your pet is treated immediately to prevent the further spread of bacterial infection and hence the development of further complications. To put it simply, the longer you drag the treatment of your pet, the worse the condition of your pet will be exacerbated, and thus the more difficult it will be for your pet to recover its full and former health. Secondly, this case is useful in showing that common standard treatments and surgical techniques can be used for specific conditions in a wide variety of animal types. For the case of abscesses, they may develop in almost all kinds of pets, from dogs to cats, and even from hamsters to terrapins, amongst other types of pets. They can also occur in humans. For this case, the attending vet, Dr. Sing Kong Yuen, correctly diagnosed a ear abscess in the terrapin, based on his prior experience with abscesses, despite not having seen such a case before in a terrapin. The terrapin was treated successfully using the standard procedure for abscesses, which would have been the same had the abscess been on a dog or cat instead. This was primarily in the form of sedation, lancing, and following that, cleaning of the wound via flushing with water. As such, vets can benefit from this case study in learning to apply common standard treatments and surgical techniques. Lastly, this was actually a rather rare case study as it involved a terrapin. Most owners in Singapore, or at least those of the older generation, were not or are generally unwilling to bring sick terrapins to a vet. This is generally due to the fact that terrapins are relatively cheap, but seeing a vet for surgery is much more expensive. In this case, the terrapin only costs around $2.50, but the surgery and anesthetic ended up costing the owner around $200. Fortunately, the owner was able and willing to pay in this case. However, the younger generation of pet owners nowadays seems more empathetic towards the welfare of their pets and seem to be more willing to bring cheaper pets to vets for treatment, such as hamsters or terrapins, as compared to the older generations. Hence, this was in conclusion a rather rare but very interesting case study. This video was filmed on location at Toa Payoh Vets. For more information, or if you wish to view more of such educational videos, please visit the following link.